All right, y'all. Okay, buenos noches. So this is my second video. Ooh. So I'm gonna talk really quickly about postpartum health. This is something that we don't discuss enough, especially not in the Black community, because we have a stigma with mental health in general. But I'm gonna talk about this. I'm gonna try to be short and sweet. So postpartum health. So first of all, postpartum. When I say the word postpartum is the period after giving birth. Okay, that doesn't mean postpartum depression, which is what I'm talking about now. That is actually the mood disorder or change that can happen to many women after giving birth. And there's postpartum psychosis, which is when women go completely what we will call insane, and they have bouts of insanity or may completely go insane after giving birth. And this is also due to the hormonal shifts and their moods changing because of the hormones taking such a dramatic dip after giving birth. And so it's very normal for a lot of women to be a little weepy. They call this the baby blues. But then postpartum depression is like when you can't stop crying and you can't kick the funk. If you've ever been depressed, you know what that's like. But it's like, whoa, I'm really depressed and I have a new baby. And so it's like you can't just crawl under the bed and pull a sheet over your head and just be like, I'm depressed. You know, you have another child to take care of. And so it's like compounded. Not to mention, some women have babies and go home to situations that are less than favorable, which force them into postpartum depression. And then when that goes untreated, you know, there's the postpartum psychosis, which can result. And so, first of all, I want to say, if you're a mom and you feel like you're going to harm yourself or your baby, or you feel like you just can't take it anymore, or you feel really sad and weepy and you can't control it, please talk to someone. Please get a therapist. There are plenty of therapists that specialize in postpartum depression. I will post some resources to this video for moms. But yeah, it's very prevalent, and especially when you have to deal with social stigmas. I know for myself, I've had to deal with postpartum depression twice. The second time, with my most recent child, was worse. I lost so much weight. I'm still very thin. I'm trying to gain weight back now. I was very, very depressed. I felt very, very isolated. I felt very, very alone. And even though my partner was being very supportive and trying to do the best that he could, I just really felt like there was just no way out of the depression. And it's really challenging. And so one thing that I want to say is, if you are a husband or a boyfriend or a mama or somebody and you notice a sister that has just had a baby and she's acting differently, talk to her. Because sometimes it's hard, not even sometimes, it is hard to be like, I'm depressed. Like, it's hard to say that to someone, and it's hard, especially for Black women, I've noticed, for us to ask for help. It's real hard. It's real tough for us to do that. And sorry. Oh, went on the wrong pipe. I just want to really, encourage my moms, to speak up and to speak out and to say something if you don't feel right, if you don't feel normal. Because that's how I felt. I felt really, really alone. But both times, and the first time, I would just cry in the shower. Because I knew if I cried outside of the shower, I could literally hear my family members being like, what the hell are you crying for? And talking all kinds of smack. And I couldn't deal with it. I already knew I'm at such a fragile place right now. I have to only cry in the shower. And that's something that's really sad. I was 21 years old, had just had a baby, and I was literally at such a low point in my life. Because it was just like, me and my son's father had broken off. My hair is looking real cute right now. We had broken off our engagement. And so there was an added level of shame because I was supposed to be getting married. Now I'm with a baby. I'm by myself. And what now? And people are talking to me crazy. and living with my parents, feeling like shit. And it was hard. It was really, really hard. This time around, not getting enough sunlight, not having the energy, not getting enough rest, not sleeping, definitely contributed to, actually me not sleeping literally drove me, I don't even have words. I mean, it's almost like I sped into the depression. Now, postpartum depression can happen up until 2 years old. It started with me this time around. My son was like 9 months, because like I said, the sleep deprivation, I mean, it was extraordinary, and I just couldn't take it anymore. And yeah, it really took a toll on my health, mentally and physically. And I mean, people who have seen me, they even made comments about my weight, but trust me, that didn't help. It made me even more angry. And my postpartum depression wasn't like me, like, I cried a lot. I was very weepy, but it was also me lashing out and being moody and being mean and being very snappy and condescending and rude to people, because I was hurting so badly. And it's like nobody was asking me how I was doing. And I think that's what I really want to say about postpartum depression, is I really want to just charge y'all to like check on your friends who have kids. Please, like, call them, check on them, see how they're doing. Now, I'm fine now, except for me trying to gain my weight back. But I healed myself. Again, y'all know this is what I do. You know, I went in the kitchen. I was whipping pots. I used motherwort for my depression. That's a personal decision. Use at your own risk. I also know that squalene is another good herb for postpartum depression, but I used motherwort, and I think I used a little bit of black cohosh as well to help me bring me out of my depression, to help to balance my hormones so that I could get out of my depression. Going outside more, and also turning off my phone helped me a lot with my depression. But yeah, I really want to make the point that it's not always weeping. Not just, you know, her being a bee. But it's also, I also want to just really charge people to check on moms, because sometimes they're not going to reach out to you. So check on these women and check and see how they're doing. And don't be like a total jerk when they say I'm depressed, you know. And that was another thing. When I did confide in a few people and told them that I was depressed, it was kind of like, girl, what, you? Please. And I mean, I can't even describe to you how I wanted to just punch people in the face, because it's like, no, I'm really drowning right here. I'm really hurting. Because at the end of the day, if something were to go wrong and one of those moms, I don't even want to say killed herself, but that's a possibility. But say she just ends up hospitalized because she's dehydrated because she was laying on the couch crying for days. Like, what kind of, like, really, how would you feel if you knew that happened to your friend? You'd probably feel like crap. So check on your friend. Check on your friends, and see how they're doing and see how you can help them. It's not all about trying to see the baby. Ask your friend how you can help them, because they have just transitioned and been initiated into motherhood, and that's not an easy transition for everybody. It's not to me, if you honestly want to know the truth, I don't think it's really an easy transition for a lot of people and a lot of women, and it's just the lack of support. It will drive any woman crazy, honestly, especially your sister friends who don't have a partner, because there's no one there to be like, hey man, Keisha acting weird. You know what I mean? Keisha at home by herself, so she's drowning in depression and thinking about hurting herself, thinking about hurting her baby, hasn't eaten in a day and a half, and trying to breastfeed. Who's gonna check on her? Who's gonna ever know that she was at that point unless you call and check on her? You know? And so I really just want, you know, yeah, I just really want to charge y'all, check on your friends, because you just never know how bad it can be for some people. I was in a really, really dark place earlier this year, and I'm telling you, I'm so happy to be done with that part of my life. But there are people who didn't call me and didn't check on me, who I really question. I question a lot of things about them now, because I just feel like a real friend would have checked on me. And if you are a real friend, you will. So definitely be checking on your friends that just had kids. Check on the dads too. It is a transitional phase for him too. But you make sure that that mom and that baby are okay, and that they've eaten, and they're not, and she's not about to lose her mind, because that happens more often than not. And that's part of my doula work. The fact that I even call women and check on them, they'd be so happy to hear from me, y'all, because a lot of them are stuck in the house with a baby all day, and it's a lot to do that day in, day out. It can make you really, really depressed. So I'll get off my soapbox, but I wanted to talk about that, especially for people in the Black community, because Black women and children are dying, and we cannot lose more women to postpartum depression. Like, it doesn't even make sense for us to be losing women to that when we need to be our sister's keeper and checking on our sisters. So that's it, and I will see you guys on the flip. Thanks for tuning in.